Hello, good day. This is the diary of the Pan African preacher. There is an African proverb that says, health is wealth. Investing in Africa's health improves human capital, stimulates the continent's economy, and reduces its social inequalities. Community health programs in Africa are therefore crucial to the continent's prosperity. They reduce geographical disparities precisely by guaranteeing access to essential healthcare services for vulnerable populations wherever they may be that in urban centers or in rural communities. Despite Africa's nation's commitment over the last 20 years, their health systems remain weak due to insufficient investment and unsustainable dependence on external aid. This, therefore, allows certain push and pull factors to increase the brain drain of health professionals from the African continent to countries in North America, Europe, and the Middle East. I was indeed surprised, even shocked, to recently discover the extent of this brain drain. I found out, for example, that the United Kingdom's National Health Service employs more Ghanaian nurses than the government of Ghana. These push and pull factors have triggered a mass exodus of healthcare professionals from Africa. The push factors include low levels of pay, irregular and delayed pay, ill equipped and ill staffed health training facilities, a lack of functioning equipment, inadequate drug supply, and poor working conditions. The major pull factor, however, is the aggressive recruitment campaigns of Western countries who target healthcare professionals in low income countries. What is particularly disturbing is that most of these countries that are harvesting Africa's healthcare professionals are already miles ahead in terms of international standards of healthcare. Let's take, for example, the United Kingdom of Great Britain and the United Republic of Tanzania. The United Kingdom population is 67.7 million, while Tanzania's stands at 67.5 million persons, so almost the same. But with this similarity in population comes a great disparity. Tanzania has 4 times the landmass of the UK, with a third of the number of hospitals, an eighth of the number of nurses, and a third of the number of doctors. With such glaring disparities in health systems, the question must be asked, why is it that the United Kingdom is still recruiting healthcare professionals from places such as Nigeria, Zimbabwe, and Tanzania? The Zimbabwean Minister of Health actually calls it a crime against humanity. The World Health Organization has red-listed the recruitment of nurses from 37 African countries and discourages the recruitment of doctors. However, the Health Sector Organization tells us that this WHO directive is ineffective in stemming the tide of migration. So, what can African nations do to slow the outflow of health professionals to the north and west? How do we get African countries to scale up the access to primary health care quickly, efficiently, and cheaply? We must acknowledge that there is no one solution to this problem. A combination of initiatives is required over an extended period of a minimum of 20 years to address these healthcare deficits. These must include the following. First, African governments keeping to their 2001 commitment to spend at least 15% of their national budget on healthcare in their respective countries. Second, African governments need to make the business environment conducive to attract the private sector to invest in health service provisions. Third, African governments need to adopt a model of healthcare that combines local traditional doctors, modern health officers, telemedicine, and where possible, mobile clinics. Fourth, African governments must be more creative in using their substantial African healthcare diaspora to give back to the development of the national health systems beyond the sending of remittances at home. Fifth, there is need for some form of government to government arrangements that links local recruitment of healthcare professionals with inward investment in the healthcare infrastructure of African countries. Sixth, African governments must pay greater attention to reducing the inefficiency that allow for corruption, graft, and wastage in the local health budgets, procurements, and logistics. I believe that Africa's health is its wealth. Ashe.